Hi everybody, my name is Dr. Daniel Grunert, and just yesterday morning I had a patient that brought in an x-ray report, and on the report it said that she had facet arthrosis. So she wanted me to explain what that meant. Now, a lot of people suffer from facet syndrome or facet arthrosis, but what is it? Well, the facet joints are specific joints in your spine, and these joints have a job. In part, what they do is they limit or restrict the ranges of motion of twisting, like in the upper lumbar region. And in the lower lumbar, those joints change their position to restrict the range of motion of bending too far forward or too far backwards. Now, there's many causes of low back pain, and the facet joints are one of them. Approximately 45% of people that suffer with chronic low back pain have facet syndrome, and that's where it's the facet joints that are generating that pain. Now, there's a lot of reasons for facet syndrome. People always ask, why do I have low back pain? Well, it could be too much straining at the capsule of the joint, like when you're golfing or swinging clubs too far and overextending yourself, or maybe bending forward and lifting and loading something up too much. It could be a synovial cyst, maybe a hypomobility of that joint where the joint's not moving and it lost its normal ranges of motion. Or it could be arthritis, like with this patient that had facet arthrosis, where it's just the general wear and tear on that joint. Now, facet syndrome could be accompanied with a lot of other conditions. So it's important that the doctor evaluates each patient individually and manage an appropriate course of care. Facet syndrome causes pain, but that pain never goes past the knee. True facet syndrome, the pain never goes past the knee. And it doesn't cause any sort of neurological loss, like weaknesses in the muscles or a decrease in your reflex. It does cause numbness, but again, that pain never goes past your knee. And with facet syndrome, it doesn't seem to worsen when you stress the hip, like in a straight leg raise, or if you rotate the hip through its full ranges of motion. Arthritis typically develops in these joints. And that's why after the age of 50 to 60 years of age, chronic low back pain sufferers mostly have facet syndrome. Now, arthritis causes a narrowing of these joints. It causes them to permanently jam up. And that's why you see some seniors or some elderly people, when they walk, they're bent forward because it opens up that joint. It makes it feel better. And you don't ever want to let it get to that point. The good news, though, is that the chiropractic adjustment is an extremely effective treatment for facet syndrome, because when I do the adjustment, that popping, audible popping sound is the release of pressure of those facet joints, which creates an increase of its normal ranges of motion and decreases osteoarthritis from developing and helps prevent it. So if you have any further questions, and typically you get relief of facet syndrome within approximately 1 to 2 weeks, typically around 3 to 6 visits. So if you have any further questions about facet syndrome, feel free to contact me. Thank you.